y'all, welcome back. I'm Mama Dr. Jones, a board-certified OBGYN, a mom to 4, and today I'm explaining chlamydia. This is the first in a series of videos on STIs meant to empower you to be educated and destigmatize this conversation around sexually transmitted infections. What is it and how do you get it? What are the symptoms? When should you get tested and why? How is it treated and what happens if it goes untreated? And most importantly, how do you prevent it? If you're new here and you'd like to subscribe, we would love to have you. But if you don't like learning about vulvar and vaginal health and sex education and pregnancy, then definitely don't subscribe because that's pretty much all we talk about here. Of note, this video is primarily going to focus on genital infections and also on people who have a vagina and vulva because that is what I specialize in. I'll try to throw in a little bit of extra information here and there when I can, but that is the topic that we're discussing today. Number 1, what is chlamydia and how do you get it?
Oh, no, wait, I know this. Are you talking about that, like, sea creature with the tough outer shell and it's green? And then it can, like, bring its neck out and then back in? No, that's a turtle, silly. I gave you chlamydia.
Chlamydia is a bacterial infection. In fact, it's one of the most commonly reported bacterial infections in the United States, making it one of the most common sexually transmitted infections in the United States. There's around 3 million cases of chlamydia reported every year, and it's probably underreported to a large degree, and it's most common in people ages 14 to 25, which happens to also be a large majority of my YouTube audience, so I think it's really important that we're talking about this here. So how do you get chlamydia? It's transmitted through the semen or cum. It is also transmitted through preseminal fluid or pre-cum and vaginal fluids. This means you can get chlamydia from vaginal, anal, oral sex, or from shared sex toys if they're not cleaned appropriately. It can also be transmitted to your eye or mouth if those infected fluids come into contact with those surfaces. If someone is having a baby and they have an active chlamydial infection, it can be transmitted to the neonate's eyes, and this is actually one of the most common causes of blindness worldwide. That being said, it is not a mobile organism, so it cannot be transmitted through things like hot tubs, shared towels, swimming pools, toilet seats, any of those things that you sometimes hear talked about. Chlamydia does not transmit that way. So now we know what chlamydia is, but what are the symptoms? A lot of chlamydia cases can be asymptomatic, meaning people don't know that they have it. That means this little bacteria is incredibly efficient, and that's probably one of the reasons it's one of the most common STIs that we see. The more people you have who have an illness that they don't know they have, the longer they go without treatment, and the more people that they encounter that they could share it with. So this is a revolving door of infections when people aren't getting routine testing and are sharing chlamydia with their partner. If you do have symptoms, the most common symptoms are pain and burning with urination. You may also notice kind of a yellow vaginal discharge, and I talked a little bit about that in my video on vaginal discharge not too long ago. A lot of people will have pain with intercourse or bleeding after sex, and some people will have kind of pelvic pain or just generalized discomfort. So those are the most common symptoms that you will see in a symptomatic chlamydial infection, but don't forget, you can have no symptoms and still have chlamydia. So how, why, and when should you be tested for chlamydia? Like we mentioned earlier, a lot of cases of chlamydia are asymptomatic, and that's why it's really important that the testing is not centered around people who are actively experiencing symptoms. Routine yearly testing is recommended for anyone under the age of 26 and anyone who is pregnant. Aside from those, if you are in a non-monogamous relationship or you have multiple partners, I would highly encourage more frequent testing. Or if you get a new partner, I would definitely encourage you both to be tested prior to having sex. For people over the age of 26, those same things, multiple partners, non-monogamous relationship, getting into a new relationship, those are all indications for testing. I'm also happy to test any of my patients who are outside of those windows or not in those relationships and just want to be tested for any reason. We really need to destigmatize asking for an STI screen because it's totally normal and totally acceptable and a really good way to be empowered about your health. Importantly, chlamydia does not discriminate. Gay, straight, cis, trans, I don't care. These are the recommendations, and you should be getting tested if you fall into the age and relationship groups that I talked about earlier, or if you're outside of those groups and you just feel the need to empower yourself and get testing done. Destigmatize STI screening. Testing can be done with a vaginal swab, which you can collect yourself or which your doctor or advanced practice provider can collect during a pelvic exam. It can also be done with a urine sample where you pee in a cup and we send that down to the lab. It's a little less likely to pick up a vaginal infection, but it's still pretty accurate. And it can also be done with a urethral swab, which is probably more common for people with a penis, which I don't take care of, so I've never actually done a urethral swab, but it is an option for testing. For infections that are outside the genital region, the testing is a little bit different, and I'm not gonna go over all of that today since we're focusing on genital sexually transmitted infections, but there are other options for those things. If you like this video and you're learning something, please consider leaving a like on it. Let's move on to number 4, how is it treated and what happens if you don't get treated?
I'm here because due to a lovely miscommunication, a lie, from my ex-boyfriend, I am taking as if from, I don't know, what you take when you have chlamydia. I have chlamydia. I'm gonna take these 2 pills, not have sex for 10 days, which is fine. I'm not really having sex with anyone right now anyways.
So chlamydia is completely treatable with antibiotics. Usually we use one called doxycycline or azithromycin. If you have allergies to those, we can find alternatives. And sometimes we will co-treat for gonorrhea because they exist together so frequently with a medicine called Rocephin. If you don't have this treated and it goes on for a long time, it can lead to further problems. And one of the most common things we see is something called PID or pelvic inflammatory disease. This is where the infection moves outside of like the cervix and vagina and up through the uterus to the fallopian tubes. So I have this little uterus model here and I'll just show it to you. But basically the infection happens here in the vagina. And as it moves, as you have it longer without being treated, it can move up through the vagina into the uterus and cause infections in the tubes here. So when that happens, what you end up seeing is people get something called pelvic inflammatory disease or PID. And PID requires more intensive treatment. People can get much more sick from that than just a genital chlamydial infection. And it also causes inflammation and scarring in the fallopian tubes and the tissues around them, which can lead in the future to problems like ectopic pregnancy, an increased risk of infertility, and ongoing pelvic pain. So it's really important to get tested and avoid having that infection move up into the tubes because that's when it gets a lot more complex. When it's caught early, and it usually is if we're doing regular testing, chlamydia is typically easy to treat with antibiotics. So come in and get tested. Destigmatize STI screening. So now you know all about chlamydia, but how do you prevent it?
Girls who made me use a condom when they were on the pill
were awesome because they didn't want gonorrhea or chlamydia or herpes, HIV, anything like that. So they clearly paid attention in health class. So they were really smart girls, but you probably didn't hang on to them, did you?
The only 100% always going to work way to prevent transfer of chlamydia is to never ever come into contact with those fluids we talked about earlier, which are infected. That means never having sex with someone who has chlamydia. But as we talked about earlier, you don't always know if you have it. And so regular testing is important here. But outside of that, always, always, always get your partner tested and yourself tested before you initiate a new sexual relationship, and be insistent on the use of condoms and dental dams no matter what kind of sex you're having. Vaginal, anal, oral, I don't care. Make sure you're using these things. For sex toys, especially if they are shared, please make sure you are cleaning them appropriately. Hello, Editing MDJ here. I just wanted to give a big thank you to the TikTokers who I use some of their videos. I will link all of them in the description box below. Some of them are my doctor friends. Others are just people who are talking about STIs on the internet. And also, hi from sunny Hawaii. I'll have a bonus video in the next week or so about why I move around so much as a nomadic doctor. And luckily for us, my next job is in Hawaii, so I'll talk about that too. Okay, I think that's everything that you need to know about chlamydia. If I left something out or you have questions, please leave them in the comments down below. If you're new here, hit that subscribe button. We'd love to have you. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you next Monday.